All right, everybody, how you doing? This is KIN214, and this is building off of the core presentation that we had yesterday in class. And this is a little bit of a oblique refresher, and I'm doing this specifically because you're going to be asked, I know for a fact, more in depth regarding this, perhaps not in this course, but in other courses, particularly 236. So it is a benefit to spend a little bit of extra time here, and hopefully this helps, like some of the little cheats that you have and some of the mnemonics that we have to be able to remember oblique as well as the posterior chain muscles for back. So let's jump into this real quick, shall we? When we look at the obliques, now you'll recognize these were screenshots that I took regarding internal, external, and transverse. And I talked about how you have transverse is the deepest of those three in the oblique group, and then you have internal and external. And there's a couple different ways you can remember these. I mean, you can just remember that transverse is the deepest. If you want to go alphabetical from outside in, you can go EIT. So you're going E is the most external, then internal, and then transverse, EIT. The other way to remember this is when you look at internal obliques are in between the other two. So you have an I for an I there as well. So meaning your internal obliques are in between the external and the transverse. And then another way to look at this, and I went into it in class, is the the internal obliques are same side muscle group, meaning when you rotate to the left, as I'm rotating to the left, I'm contracting the obliques on the left side of my body. It's the same side contraction, meaning it's ipsilateral. And I drew this out the other day. If ipsa is on one side, contralateral is the opposite. So the internal obliques on my left side are contracting as I rotate to the left. It's an ipsilateral contraction. Again, another version of an eye for an eye. So there's a couple of different ways you can remember this, but I think if you can just pick one of those, it'll definitely carry you through the rest of this class. It'll carry you through 236, hopefully further in your academic career and in your actual career moving forward. So just recall EIT, going from external, internal to transverse, from superficial to deep, or you can even do just I for an eye, ipsilateral, as you contract the internal obliques to rotate to the left. I put in this, this is a link out right here on the left to this article over here on the right. This is quite good. I would take a moment just to review, but you can see where I took the cut and paste from when I did my search for this for you guys. So it's a pretty good article, and I think you'll be able to just kind of breeze through it rather quickly. It's mostly bullet pointed, and it's pretty darn helpful. Now, in class, I went into low back muscles, and I talked about the individual nature between each vertebral level that you have, meaning L5 to L4 to L3 to S1, L5, L4, L3, L2 up into the thoracic region, T12, 11, 10, 9, 8, all the way up to the spine, up to the cervical area of the spine. What you have to really envision is it's not just one long muscle. Although it's a series, I can describe it, it comes off as like a long ropey muscle, but it's actually a series of smaller, all interconnected muscles that all work together in unison to do sagittal plane movements like hyperextensions, or at least even just stay erect in the spine, so named erector spinae group. If we break down the etymology of these three, spinalis, longissimus, and iliocostals, it's a little bit easier to kind of dissect what's going on in the body if we dissect what's going on with the actual words. When we look at iliocostals, costals are referred to as ribs. You have intercostal muscles, which are on the front side of the body, and they actually come around the back side of the body, but those are muscles in between the ribs that help us with respiration. So you have muscles that work to help us with breathing, but also you have muscles that are attached on the back side of the body, the iliocostals, that help us to stay erect or upright. And the iliocostals, so named because they relate to the ilium, you can say iliac crest on the, down here on the hip bone, there you go. And the ilium itself, when you say ilium in Latin, it refers to the lateral side. So a way to remember this is iliocostals. It's the most lateral muscle, not medial, but most lateral. And this group of muscles attaches specifically to the ribs out here, the costals. When we look at longissimus, it's the longest of the back muscles, runs all the way up the back here, up to the base of the skull. And you can just go longissimus, longest of the back, L if you want. And then the spinalis, spinals, depending on how you pronounce it, they're most medial or they're nearest to the spine. So probably the easiest way to remember this is, depending on your pronunciation, spinalis or spinalis, these end up being closest to the spine. They're the shorter of the three. Then you have iliocostals, ilio meaning ilio relating to the ilium, the lateral aspect of the body. They're most lateral of these three. And costal is the other dead giveaway. They attach to the ribs, and costal terminology means ribs. And then you have longissimus, the longest of the three, and that's going to be in the middle. So again, you can maybe use them in different mnemonics. One is spine for spinalis. One is iliocostals. It attaches to the ribs. If you're ever asked a question, which one attaches to the ribs, which one attaches to the spine, you now know. The other way, maybe think of this, if you want to go from medial to lateral or lateral to medial, you could do it alphabetically, ILS, much like we did before. So I hope these little takeaways are enough to help you guys out. I know, for like this class, we're not focusing so much on the nitty gritty of anatomy, but sometimes just learning like the etymology of these words and learning some of like the nuances of like, what's a costal, and what does that pertain to anything. It tells you a little bit more about the actual muscle that's moving. And you'll see this later on when we talk more in terms of being more hands-on and we talk more about more specific muscle groups. But I can tell you, as you move further in your academic careers and professional careers, you'll dig more and more into this as a means to help you with movement, but also as a means to help you more with evaluating possible dysfunctions that might happen or be apparent in the system itself. So guys, I'm going to sign off here. Have a good one. Thanks.